Morning, this is Gypsy Wana with Community Health Education Program. You are watching CHE Fast Fact. We do the show every Tuesday and Thursday, and we give you about 5 minutes worth of fact or 5 minutes worth of information. Today I was just going to talk a little bit about vaccinations and vaccines. There are several vaccines that are available today, at least compared to, there were a lot compared to when I was younger. But there are several diseases that we don't see anymore today because of vaccines. One of them that's been eradicated or almost eradicated is the polio disease. Polio, that's a crippling disease. It could be deadly as well. But anyway, polio, I was just going to name a couple of the serious ones. They're all serious, I guess, because they can all have serious effects. Measles is very contagious, and there's whooping cough. That's where the, especially in babies, they have a really hard time breathing if they get that cough, and it's not good. Anyway, so I'm just encouraging everybody to get their children in for their vaccines if they haven't gotten them. With the coronavirus that's come up, some people have been holding off on coming in to get their babies and their well visit checkups and things. But it's important that we still get those vaccines. And now that there's a lot of precautions in place, and they're starting to know more about the virus and how COVID is spread, it could be good to bring your child in. You just call, make an appointment. If your child hasn't been seen for a well visit checkup in a year, they will need to have an appointment with a provider. And apparently if they've had a well visit within the last year, then maybe they can only do, they can get a nursing only appointment. But you would call the IHS clinic at 698-7606, talk with them and let them know what you need, and they'll see if they need to, which appointment to set you up with, either a nursing only or with a provider. And again, that's a lot of disease. There's pneumococcal disease. And that one's causes ear infections, sinus infections, pneumonia, and maybe even meningitis. Some of these diseases that are vaccine preventable cause really bad diarrhea, such as the rotavirus, or was it hepatitis A? Oh, that's a liver disease. But yeah, these are, some of them are not really good. And so it's 14 diseases that vaccines help prevent. And with this coronavirus, everyone's wondering when there's going to be a vaccine and where the vaccines are and how long is it going to take. And it seems like a lot of people want to get that vaccine. And so that's what all of these other immunizations are for too, to prevent these diseases. And can you imagine back then when polio was first supposedly discovered, everyone was, there was a lot of people dying, a lot of crippling things happening. And so people were just as anxious as we are today for the COVID-19 vaccine. That's how people were before for the polio vaccine or for the tetanus vaccine, or the hepatitis A or the hepatitis B vaccine. So that's all we wanted to do, is just promote people getting their immunizations. And if you had any questions about those vaccines, talk with one of the nurses or one of the providers here, and get the information, or get it right from the doctor or the nurse if you have some serious questions and stuff, because there is a lot of misinformation out on Facebook and on the internet and stuff like that. And so that was another thing where I was wanting to promote reliable websites and information, and we get a lot of our stuff from the CDC website, which is cdc.gov. I think that's all I have today. Again, just calling IHS for an appointment for your children to get their vaccines. And flu season is coming up too, so keep an eye out for when the flu vaccine is available. Okay, so that's all. Thank you for watching. This is Gypsy with the CHE Fast Fact, and we'll see you Thursday. Bye.